Welcome to SheTV.com, where board-certified physicians talk to you about women's health. This video is about vaccines during pregnancy.
Hi, I'm Bailey. I'm a nurse at Lakeside Women's Hospital here with Dr. Dana Stone, here to talk about recommended vaccines during pregnancy. Dr. Dana Stone, you are a board-certified OB-GYN with us, so I was hoping today you could talk to us a little bit about your background and how you became interested in this topic.
Sure. Well, I've been a general OB-GYN in practice in Oklahoma City for more than 25 years. I have always believed that the best medicine is preventive medicine. We are very interested always in the latest cures and the latest procedures, but really we get the best health outcomes when we prevent disease. So things that aren't very exciting and seem mundane, like vaccines, are really our best ways to keep us healthy. So that's kind of why I really am kind of the vaccine queen in our clinic.
Awesome. Well, that's great to know. I have lots of good questions for you today.
All right.
So what about doing this video? What are some things, who are some people you hope to impact, and what are you hoping that they hear from this?
Yeah. So we see our patients during pregnancy multiple times. And so at various points in the pregnancy, we're talking about different things that are going to keep them healthy, keep their babies healthy. And sometimes vaccines just seem to come out of the blue. So we have 4 vaccines that are recommended during pregnancy. 2 of them are going to be seasonal. The RSV, the brand new RSV vaccine, and the flu vaccine. And then 2 of them are going to offer to patients no matter what time of year they are pregnant. And that would be the pertussis vaccine, which comes in the Tdap, and the COVID vaccine. And all of these vaccines really help protect both the mother and then the baby, and continue to protect the baby in the first few months of life.
Awesome. So run us through a little bit real quick, kind of the ideal routine, like when a mother would receive these during pregnancy, would baby receive these after delivery, what the ideal situation would look like.
Yeah. So first, we always want to talk about the safety of the vaccines. And these are all these are all approved by the Federal Drug Administration, FDA. They are all reviewed by a specialized subcommittee in the Centers for Disease Control that reviews all vaccines. And so these are nationwide and often worldwide recommendations during pregnancy. So we have a lot of faith in the safety and effectiveness of these vaccines. So that's one of the first things that I like to get across to people.
Yeah, that's super good to know.
Yeah, these are very well researched and very safe vaccines. So the COVID vaccine, really, if you are not up to date with your COVID vaccine during pregnancy, you should probably go ahead and get that early on, just because COVID, we think it's going to become seasonal, but we have it at some level all the time, all year round.
Right.
The other vaccine that we're going to suggest that everyone get is the pertussis vaccine, and we like to get that in the last few weeks of pregnancy. All of the vaccines will have their best effectiveness for the mother and the baby 2 weeks after they're given. So some of these, we don't want to wait too long to give them, but we also don't want to give them too early in pregnancy where they lose their effectiveness for the baby. The pertussis vaccine, we usually give 34, 36 weeks.
Okay.
So later in pregnancy. Then the new RSV vaccine. So RSV is a virus, respiratory syncytial virus, that a lot of people have heard about that affect babies. And it's very dangerous. One of the reasons I really am excited about this new RSV vaccine is because my sister's second baby was diagnosed with RSV when he was just 2 months old. She was terrified. She took him in one day, and the physician thought he's got a cold. The very next day, she took him back, and the physician said, take this baby directly to be admitted to the floor. He's turning blue. He was in the hospital for a week. He was on 5 different monitors. He had the up-to-date antivirals at the time, and he was a healthy term baby. And she was just terrified. So when I heard that this RSV vaccine was available now, I thought we can save a lot of people, parents and babies, this heartache, and and there are deaths, or 300 to 500 deaths of babies with RSV every year. So even though it's a brand new vaccine, we feel that this is very safe, going to be very effective. It's going to prevent 90% of these early RSV cases when babies are the most vulnerable to getting RSV and to becoming hospitalized. Tens of thousands of babies are hospitalized every year, and we can prevent 90% of those with this vaccine. This will just be given September through January, so women who are pregnant September through January. And we're going to be giving it probably 34 weeks through the whole 36 weeks. So when you turn 37 weeks, then that's probably a little bit late to be giving it. The one safety concern that they had when they first started giving it, they gave it earlier in pregnancy, and they saw a very tiny increased risk of some preterm labor. So they said, you know what, it's better when you give it to the mother a few weeks before delivery anyway. So let's just not give it until we get to that 34-week time frame. Mm-hmm. Then we won't be worried about that very possible tiny increased risk. So that timing between September through January and between 34 and 36 weeks is the time frame for the RSV vaccine. And then flu is the same. We've suggested the flu shots every flu season for our pregnant patients for a long time. So flu is very protective for the mother. So moms are usually more interested in the protection the baby's going to get. They don't worry so much about themselves. So, but mothers are at higher risk of complications of the flu. So moms are at higher risk of ending up hospitalized in intensive care, and there are even a few deaths every year because you're more vulnerable when you're pregnant. And then the babies also get that protection. So all of the antibodies, natural infections, and vaccines that mothers make are passed along to the baby while the baby's in utero. And so the mother gets the protection from the flu shot, and then the baby gets the ongoing protection for the first few months of life. So when the baby's born in flu season, then it has that protection too. That's why pertussis works for babies. That's why COVID gives babies some protection, and that's where the RSV protection comes from. The mother gets the vaccine, her antibodies that she makes in response to the vaccine passed to the baby in the uterus, and then the baby's born with a few months of that protection.
Very cool. That's all really good information. Thank you.
Yeah.
So with this RSV vaccine, you did say this is going to be a seasonal kind of vaccine versus a regular recommended vaccine in pregnancy.
Right. There is another wrinkle to the RSV vaccine. About the same time they came out with a vaccine for the moms, they came out with an antibody treatment that babies can get when they're first born. So there's it's a monoclonal antibody, which means it's just produced to be one type of antibody that the baby would get. There is not very much of that this year, so that is very difficult to find. And so, if a mother misses that opportunity to be vaccinated during pregnancy, then you can start looking once the baby's born and see if you can find that extra protection. But if you have a choice, there is some indication that maybe the baby will get protections from more types of RSV with the maternal vaccine. than with the monoclonal antibody that the baby would get after delivery. That sounds kind of confusing, but
No, I'm tracking. I get what you're saying.
yeah.
Cool. Okay. Thank you. We look forward to speaking with you again about other interesting topics regarding women's health.
Thanks. I look forward to it.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please check back often, as we will be constantly adding new content. If you have any questions or particular subjects you would like us to address, please email us at shetv.com.